we have a comment that you shouldn't run away from doctors. And I do think people are intimidated when they're in a doctor's office. So I'm really glad that we're encouraging people to think in advance. Are there other things that you encourage people to do so they feel more comfortable with their healthcare professional?
Yeah, I think that it's important that you find a doctor that you feel like you can talk to. That sometimes takes a long time to find a good fit. And I think it's really hard, especially as teenagers get older, to move like from their pediatrician to an adult provider, and just knowing that that's going to take some time and some essentially doctor shopping to figure out a good fit, and that it really is okay to try out different ones. I think too, like, doctors are not the most accessible place either. Like, doctors' offices are not the most accessible place. Like, the physical accessibility of just, can I even get in the room? Can I get in the exam room if I use a wheelchair or something like that? And then, thinking about the lights and the noise and the smells and all those kinds of things. And so figuring out if there's a good fit with that, and asking for, rather than being moved from room to room, if the person that you're supporting has difficulty with those transitions, to just say, can we go to like one room and wait? Kind of thing. Is there a way to minimize the wait times, to talk to the office staff about those kind of accommodations with scheduling, to let the doctor's office know if you know that it's going to be a longer appointment, so that they can schedule it accordingly. Those are all like examples of things to maybe be able to do.
I think those are really important. And I think sometimes families don't know that there are doctors that make those accommodations. We support a lot of people residentially, and they will make them first appointment of the day so they can walk right in. Or we've had doctors meet with people in parking garages who just wouldn't go into the doctor's office. So we've had somebody ask about tips for doc shopping. And I will say, on the ARCS end, we maintain a list of doctors that families have recommended. So you can always call a family navigator or ask other families. I think they're great resources. Wanda or Katie, do you have other recommendations?
I think one of the challenging parts is like getting a recommendation from a family member, and then just making sure that you take that extra step to make sure that they are on your insurance network, because you don't want to find a doctor that it's going to be like not work out with your insurance.